I'm Dr. J.D. Allen. I'm an orthopedic surgeon with White River Health Systems. I've been in practice here for almost 40 years now, which is a little scary. My partners, Dr. Jeff Angel, Dr. Dylan Carpenter, and Dr. Wes Greer, are all board-certified orthopedic surgeons. We've been in practice together now for, Dr. Angel and I, for over 20 years, and Dr. Carpenter and Dr. Greer are recently joined our practice. We do general orthopedics, and I know that in times like now that we are going through the coronavirus epidemic, everybody's concerned about getting out, about going to the doctor's office, about going to the hospital. And I wanted to touch on some of the things that we're trying to do to make it safer and certainly more hospitable for patient care. Our office is right across the street from the hospital, and we actually meet our patients. We have part of our staff meet the patients in the parking lot, interview them. They don't come into the building until about 5 minutes before their appointment time. They are screened for temperature, cough, malaise to see if the patients feel bad. They're asked if they have been exposed. We encourage the use of masks. We would certainly like to see everybody that comes in to wear a mask, not because we know that there's a problem in the building, but because we don't know. And that's one of the things I think the fear factor right now is high, because everybody wonders who's got it and who doesn't. And I think that that's a real concern and should be. But I promise you, in our office setting, we don't let more than, I think it's 8 people in the building at the same time. They're spaced at least 6 feet to 10 feet apart. And they're seen promptly. We really don't have a long waiting time in the office. So I think that we're doing all the things that we need to do, and certainly the things that are recommended by the CDC to make patient care safer, particularly from an office care standpoint. We've also recently been starting back to do some elective procedures. We continue to do emergent procedures, fracture care, infections, the things that won't wait. But trying to identify the things that we have felt in the past, and certainly collectively the orthopedic community in the state feel can wait, should wait during periods like this. We've stayed away from doing total joints. We've stayed away from doing elective shoulder surgery, even elective knee surgery, and really just stuck to doing the trauma and doing the things that won't wait. We're now starting to creep back into doing outpatient elective procedures, or at least semi-elective procedures, in our ambulatory surgery center. We're trying to keep people, trying to take care of people that need to be taken care of. I mean, somebody that hurts their knee, that has a torn meniscus or a torn cartilage in their joint, somebody that has an absolutely painful problem that we don't feel, in our best judgment, should wait, then we're taking care of it. We're hopeful that within the next few weeks we'll get the green light to gradually ramp up with first outpatient surgery, and then eventually doing joint surgery, doing reconstructive surgery of the shoulder, reconstructive surgery of the knee, that is a little bit more intense than just minor outpatient procedures. We do not operate in our office. We operate in the ambulatory surgery center here at White River, and then eventually, hopefully in the next few weeks, we'll be able to ramp that up into doing outpatient procedures and inpatient procedures electively here at the hospital. We have the good fortune of being in a rural community, and so we don't have a population density that is a threat to us at present. But we also assume that somewhere in our community we are going to have cases that don't realize they are infected, and those are the ones that we are trying to identify on the front end, and those are the ones that we feel like we should identify on the front end for their own best interest, but also to protect our staff, to protect our hospital, and to protect the people that are responsible for taking care of folks. It's a tough time. It's an unprecedented time, and certainly we think that using the best information we've got, the best information and recommendations we can get, that we're gonna survive this well. We like our position here in Batesville primarily because we don't have a huge population density, and we do have, I think, a wonderful hospital and staff that are very disciplined in how we approach this problem. Certainly, if you have questions, please feel free to call us at White River Health Systems Orthopedic Clinic. The numbers are I think, are available, but we have people that are perfectly capable of answering most of your questions and can help set you up to see us if you feel the need. Thank you.